Welcome everyone to our weekly Facebook Live conversation. This week we are going to be discussing the impact of COVID-19 on child care service and subsidies. We are very excited to be joined by the Commissioner of the Connecticut Office of Early Childhood, Beth Bai, as well as her colleagues, Harriet Feldlofer, who is the Director of the Division of Early Child Care and Education with OEC, as well as Eileen McKenna, who is Home Visiting Program Manager and Birth to 3 Family Liaison with the Connecticut Office of Early Childhood. And of course, Kelly Anelli, who is CCAdv's Director of Member Organization Services, will be leading the discussion with the Office of Early Childhood. So I'll just turn it over to Robin to do some housekeeping.
Hi, good afternoon, everyone. Thank you for joining us for our discussion this week. Just a few things before we get started. We are broadcasting this webinar on our Zoom channel. So anybody who is on the Zoom call right now, please feel free to open up your group chat on the right-hand side. And as we're going through our discussion, feel free to add any questions, concerns, comments that you may have. I will be moderating this and keeping an eye on it, and we'll interject and field your questions to our panelists. You can also raise your hand as a feature on the side of your chat feature as well. So go ahead and raise a hand if you'd like to say something, and you can go ahead and speak at that time. And then we're also broadcasting over on Facebook Live. So I will be keeping an eye on that. If you are on our Facebook Live audience, please feel free to ask any questions that you may have there as well, and I'll make sure they get to our panelists. All right, I'm going to pass it over to Kelly. Thank you guys for joining us.
Thank you, Robin. Good afternoon, everybody, and I'd like to thank Commissioner Bai and Eileen and Harriet for joining us today. I think we're going to have a really great conversation, especially, I know it was my son's day of school, so everybody's trying to fit to see what's going to happen next. And it's also the opening of phase 2 for the state. So I know that this is going to be a great conversation on what to expect next. So jumping right into it, I mean, you guys can, I'm wondering if this is a question for Harriet or for Commissioner Bai. Knowing that childcare has remained available throughout COVID-19, can you explain what are the changes in services and what parents and guardians should expect for a timeline as the state reopens?
Sure, I can take that, and Harriet, you can follow up if I miss anything. Childcare in Connecticut was never closed, so it didn't have to reopen. Many programs, about a quarter of centers stayed open, and 2/3 of family childcare homes remained open during the pandemic. But there have been and continue to be strict public health guidelines to keep children and families safe. So one of them is parents should expect that children will be screened for temperature on the way in. They should expect smaller class sizes. Right now in Connecticut, the maximum class size is 10. Very often during regular times, classes can go up to 20. So they can also expect that those 10 will stay in a single group, so there aren't like floating teachers in and out among the groups to try to mitigate any disease spread. And there's also enhanced cleaning and hand washing going on. So childcare providers have been working really hard to meet these standards and to keep children safe and to support families as they're returning to work.
Harriet, did you want to add anything to Commissioner Bai's statement?
Sure. Just that although many programs that we fund closed, we actually were able to allocate state and federal funds for several what we're calling sort of COVID emergency Connecticut Cares for Child Care programs for frontline workers and essential workers and hospital workers. So while we saw some of our state funded close, some programs did either reopen for these special groups or new providers that were not yet receiving state funds opened up. So we actually were able to serve more children than we would have without some of these programs. And I believe the trend is now slow, but emerging that programs are beginning to reopen the end of June and in July.
Yes, we have right now, parents may find it hard to find childcare right now. I mean, we have about 16% of the supply we had pre-COVID, but if they're having challenges, they can call 211 Childcare to try to locate childcare. And every day more programs are opening, so that's changing over time.
Great, thank you. Given many children were not able to receive physicals during this time, are there policies put in place for children who are not up to date with their immunizations?
Yes, what we did was the governor signed an executive order that granted a waiver during this time for immunizations. And there'll be a timeline during which parents will have to get children caught up, because we also don't want that problem either of kids not being immunized. But for now, there are waivers to that rule.
Excellent. And is that timeline available on your website, or will that be available on OEC's website?
We'll be alerting programs. And I think I should be clear that basically the waiver is it will accept old, will accept expired physical forms. But a child would have to show that they'd had some of those before starting. So they'd have to have an initial physical form to start at a childcare program.
Excellent, thank you. How has COVID-19 affected the Care for Kids subsidy in regards to both those who are initially applying and for those that are doing redetermination?
I'm going to have Harriet answer that one.
Great question, thanks. So Care for Kids remained open, as did other programs. No backlog, we're all caught up. So new applications are being processed readily, as are redeterminations. And very recently, we amended our CCAdv plan so that families who at redetermination, who had a job loss or had been furloughed, would not be eliminated from the program, but rather given a half-time certificate so they could continue doing job search. And a half-time certificate is up to over 24 hours a week, so it's still quite a bit of time. And then we ask that families, when they resume at their work or get a new job, we ask that they let Care for Kids know, so we can be sure to have all the correct information on them and also get their new level of care that they need.
And Harriet, just to follow up on that, what is the turnaround? So if a parent or guardian has gone to half-time, what is the turnaround once they have been able to show their employment for the full-time care to come into play?
So if they've gone to half-time, they don't have to report that. I was just saying at redetermination, if they have lost their job, they're no longer employed, or they've been furloughed, rather than be not eligible, they're actually eligible for a half-time certificate. And we'll issue that for 12 months. And then when they get a job or go off furlough and their level of care changes, we'll obviously add to that certificate. Does that make sense?
Yes, very much so. Thank you very much. That's an interesting piece. What changes should parents expect in terms of summer camps, including transportation and enrollment, to maintain the social distancing and other regulations put in place?
Yeah, we also oversee summer camps, and parents can expect some of the same things, like smaller group sizes of 10. Right now, there could be some adaptations to that in the near future, but smaller groups, screening for temperature on the way in, social distancing as possible. Some camps may be requiring children to wear face masks. They should expect all the adults working in the programs will be wearing face masks, so letting the children know that's how it's going to be could be helpful. And to the extent possible, there's social distancing, but that's part of the idea of the small groups of 10 is, if you have a camp of 200 kids, in the past, they would have all been interfacing at lunch and they'd be with all the different staff. Now they can expect their child to be in a huddle that spends a day together doing different activities. And camps, much like childcare, are cleaning between groups, like before the playground switch, the whole playground will be sanitized, bathrooms are sanitized between groups. So like childcare centers, camps are really stepping up and meeting these health guidelines. We all want kids to have fun, but we all want them to be safe as well.
I have a follow-up question for that around the face masks. Are the camps in the child care facilities, are they going to be providing the face masks for children, or is that something that we're asking parents and guardians to provide?
Well, in childcare, there's an explicit exemption about wearing the mask, that children in childcare do not need to wear the masks. Now, if a center requires that, they might have a policy of that, and they would work that out with the families. And I think camps are very much the same way. Some of them are childcare, and others will be requiring masks of the children, and it will vary based on the program.
Thank you for that. And I'm not sure if you're able to answer in regards to transportation. I know many camps in Connecticut have transportation included in it, and there's been a lot of different thoughts around that and different ideas. Can you just clarify what the transportation for some of those camps are going to look like?
Sure. A lot of camps that usually provide transportation are not right now. I think that is just the reality. They can't figure out how to do it and live with all the rules. So the ones that do have a bus, the children will be screened for temperature before being allowed on the bus, and they will be socially distanced on the bus with groups of 10. So, there'll be a group of 10 in the back with 6 feet between them, and then another group of 10 in the front. So there'll be fewer kids on the bus, and social distancing and face masks may be required on the bus. Some of that will depend on the bus company policy, the camp policy, and state and CDC guidance.
Excellent. Thank you, Commissioner. Eileen, I'm going to put you on the spot and talk a little bit about home visiting. So in regards to home visiting, I know that must have been quite a change and kind of difficult to navigate at first. How has the initiative changed, and what are some of the restrictions in place and some of the steps moving forward?
So as of March 23rd, we have been providing virtual visits to families. And for the most part, this has been successful. There have been some issues where families maybe didn't have a good data plan and couldn't do a face visit on their phone. And for some of those families, we've been able to distribute tablets to them. Again, there's some internet access issues. But by and large, our programs, our home visitors have reported that they've actually seen an uptick in their ability to connect with families. Our programs have shown amazing creativity and resourcefulness. Not only are they managing to stay connected with their families weekly, some report even more frequent contact because, they can pick up the phone and call them and just check in. So, that seems to be going very well. And we're not just having virtual visits, we're still doing virtual groups. We've heard some of our programs are doing story hours with moms and dads and their children. And we even have a virtual infant massage class going on right now. I do want to shout out one thing that we did very early on. It was a partnership with CCAdv. In late March, Ashley Starr-Frechette reached out to OEC saying, hey, we have some resources that we think would be really good for home visitors regarding IPV during COVID-19. And, the conversation about sharing these resources quickly turned into a talk about creating a webinar for our home visitors to talk to families about IPV and what resources are available to them, particularly when they are sheltering in place, possibly with their abuser 3 feet away on the couch. And Ashley said something to me back then that has stayed with me. She said, victims of domestic violence have been isolated long before COVID-19. So initially, we had planned one webinar for 50 people. Within minutes of sending that link out to providers, it was full. Ultimately, we had 4 webinars. We trained close to 200 people. And when I shared this training with Elena Trueworthy, the director of the Head Start Collab office at OEC, she wanted to get in on it too. So she had the webinar available to her Head Start home visitors. We've also been able to distribute diapers to our families. We gave out a 1-month supply to every child enrolled in home visiting. We've done a food survey with Head Start to see what the food security issues are with families. And we found that 32% of families are having difficulty obtaining baby food and formula. And the last thing I want to say is that our fatherhood home visitors, who have been doing amazing work in the prisons with dads there, have, of course, not been able to get into the prisons. And so this group of fatherhood home visitors wanted to have a project for right now. And so they developed this project called Fatherhood Safe Cars, Safe Kids project, and we're going to be distributing seatbelt rattles to remind parents that the children are in the car, and also information and facts on an information fact sheet on hot cars in the summer. So that's it from home visiting.
Great, thank you. That's some great information. I mean, I find it so so amazing how we all continue during this to do the work in all of our different arenas, and that is really what is important, is that we all just kept going, and no matter, it really didn't stop us. And it's nice to see. I appreciate you mentioning Ashley and the collaboration that she provided as well. It's always nice to hear of a positive collaboration between two different entities. Eileen, you spoke about some of the projects and initiatives that's coming out of home visiting, but I'm not sure if Commissioner Bai or Harriet can talk a little bit more about some project and initiative that OEC is offering to families, maybe that they could find on your website, and some great resources, especially with summer coming up and kids being home. You know, what's that looking like?
Yeah, we do have some really good resources on our website. There's a link where they can click for families, and there are resources. We are working to open up more childcare options for families, and even some distance learning with early childhood programs that we are now funding that may well be available for those programs, for those families from those programs. And we have about, I don't know, there are well over 100 programs that have this option to offer some of those programs for kids. We did have a childcare subsidy program that was specific for frontline workers, but that is winding down. I think it's now officially closed. So that's not available anymore. But I think there are resources on our website for families, and we're working really hard to get a supply of childcare available. And all families can apply for Care for Kids, which is a subsidy program that Harriet was speaking about before, if they need help paying for childcare. Now, the other thing is, if families have concerns about their child's development, they can also call 211 Child Development Info Line and get connected with Birth to 3 and have their child evaluated, even remotely. We've seen a big downturn in referrals to Birth to 3, and this is an incredible resource for families to sort of follow up if they have any concerns about their child's development, about their speech, about their physical capacities, about their hand strength, their balance. And you just call 211 and ask for Child Development Info Line, and you'll be referred for an evaluation to Birth to 3. And that's really starting from birth to 3 years old. Some of those services will now continue through the summer versus be sent to the school districts. Birth to 3 will remain with those families.
Great, thank you. Eileen, just to expand on that just a little bit more, because I know we're remote, can you just discuss how the remote Birth to 3 works, and if you guys do foresee in the future of going back to face-to-face, or just an overview? I know very many people are very skeptical about the remote work, and I think we've all become very comfortable with it, but if you could just touch upon it a little bit, I'd appreciate that.
Yeah. So Birth to 3 is, as Beth said, able to do evaluations. They've been able to figure out how to show families what they want to have the family have the child do during the evaluation period. And it seems to be working all right. Birth to 3 really is a program that is focused on coaching the parent on how to fit the strategies that will help their child development within their daily routine. So this is really a great opportunity for families to become more hands-on with their children. A lot of times when an expert, like a speech therapist or an occupational therapist or a PT, is in your home, families may want to defer to the expert. And Birth to 3's model has been for many, many years. The parent is the expert, and they're going to be coaching them on the strategies. And I think with this virtual way of connecting with families, it's really being implemented very well. They can't put their hands on the family, on the child. The parent has to do that, and that's long been our model. So I think it's working.
Thank you. All right, so here comes the million-dollar question, right, that everybody loves. And I'm not sure if you all want to chime in just a little bit in each area, but what do you foresee for the fall? And I'm not asking from the State Department of Education, and so don't worry, I'm not putting you on the spot with that. But more so, what do you see with the fall with changes? Do you have any ideas of timeline of what it looks like? What are you working on? If you could just kind of touch base upon that, I appreciate it.
Sure. Well, I mean, it is a pandemic, so we can never be 100% sure, but today is a day to be really hopeful in Connecticut. There were almost no deaths yesterday. That's incredible. Our testing rate is down in the 1%-ish range, between 1% and 2% in terms of positives from testing. And today the economy is reopening more in the next stage. So, it's beautiful out there. It's like the perfect Connecticut day. What we're hoping is that, sort of each month we'll assess where we are. We're hoping to be able to open up more capacity over time, of course, with public health in mind. And, families may have their own anxieties about heading back to childcare. And that's why it's important that you've asked the questions today, that there are all kinds of safety protocols in place at those licensed childcare centers. And I do remind parents to trust the licensed care, whether it's family childcare or center care. Both are really good options, but you want to make sure that it's licensed care. And know that if they're licensed, we are checking to make sure they're following those health protocols as well. So you have that extra layer of protection if you pick licensed care. So hopefully by the fall, we'll be pretty close to typical operations. The class size might be a little smaller. There'll certainly be continued enhanced cleaning, potentially likely still face masks, some screenings, but I think we're all learning to live with this, and I know parents need to get back to work, and childcare programs need families to stay in business. So that's why we're all working closely together to maintain the public health and have high quality programming for kids.
Just another thing, Beth, reminder that for the programs that we're funding this summer, we're asking them to do family surveys. So we get a real good sense of the supply and the demand. Surveys about how are you feeling about sending your child? What are your expectations? How is the staggered scheduling work? Online learning? So hopefully over the next few months, we'll get some good qualitative data on what parents are thinking and feeling, and get a sense from that end about what the need might be on their end. So I think that'll be very positive, and I think we're really interested in the information.
Great. Thank you, Harriet. I know Robin has any questions come in. I'm sorry, I'm not sure how to monitor that.
Mute. Okay, there we go. We do have a couple things from our Facebook Live audience, and I know we were discussing just now, we sort of touched upon it, but is there any chance that we will see like a daycare capacity increase at all, in your opinion?
That's a great question. Yes, we are seeing more programs open, and we are seeing that more programs are opening with more than 30 children. And we will be looking at the class size in the near future. I believe there's a meeting on Friday to look at class size, but it's not all going to happen at once. We didn't get into this at once. And I know as commissioner, I'm working with the Department of Public Health to make sure the steps we take will keep children as safe as possible, and also keep families and workers as safe as possible. These childcare workers have been out there on the front lines throughout the pandemic, and we want to continue to ensure their health as well. So we're going to take it carefully, but yes, capacity will increase. It's increased, it's gone from 14% to 16% of slots available in 2 weeks. So that's not monumental, but it's creeping up, and we are finding that families are slow to send their children back. So, you know, it's a matter of, we're going to spend the summer really looking at supply and demand to be ready for the fall.
Thank you. I feel like I too am a mother of a 2.5-year-old, and I'm trying to get my daughter into a daycare program, and it seems like they don't know what they can do yet. It's still, everything's really up in the air. So it seems like as the demand is, like people are like fighting over spots because there aren't enough out there.
Well, Robin, before the pandemic, Connecticut was short 50,000 infant toddler spaces. So you can imagine that that was a problem before, and now we're down another 40,000. So those are like gold right now. And we're doing a lot, like we're working to support more family childcare homes and support the opening of more family childcare homes throughout the state. And we received a grant to do that. So we now are going to have 10 childcare networks that are there just to support family childcare programs at this time and for the years ahead. So hopefully we'll be expanding that capacity in the near future.
Sure, I just want to add on to that, if you can, because we were talking about the ratios, and it's 10 children to a room, and that's preschool age up, correct? So
right.
infants
and toddlers are 8 per room, right?
Right.
So there can still be 8 per room for infants and toddlers because that is within the maximum group size of 10. Okay. But still, the 8 holds.
Excellent. Thank you for clarifying that.
Yeah, thanks for asking.
I think sometimes that parents don't understand there's a different ratio for different ages, and that's
right.
why those are the gold spots to get, right? Because there's not
golden
as much
ticket. That's your golden ticket.
Right. I'm not sure, Robin, did we have any other questions from Facebook or from the chat?
We do not at this time.
Okay.
I'm looking down. Nothing on Zoom, nothing on Facebook Live. Thanks.
Absolutely. Okay, I guess we'll wrap up. I'm not sure if Commissioner Bai or Eileen or Harriet have anything else that they want to add before we end our call, but I just want to thank you all so much, Commissioner. I can't imagine, Eileen, Harriet, the time that you took out of your day. We appreciate it so very much. Just trying to get that info out there for everyone. So
we're so grateful for what you're doing every day. I mean, what you all have done at CCAdv to keep supporting families is amazing. So we're always happy to support your efforts, and we appreciate you helping us get this information out.
Oh yeah, thank you so much.
Yeah, thank you.
Thanks for including us.
I know you have Liza can provide some.
Yep, just to close out, again, thank you everyone for joining us today. And just to close out, we always want to make sure that folks have the contact information for Safe Connect. So I'm going to just put that up on the screen real quick. Again, Safe Connect is Connecticut's domestic violence resource hub. It's operated by CCAdv. It's available 24/7. You can connect with an advocate, even if you just want to talk. But these are some of the specific services that our advocates can help you with. And they'll also make that safe connection for you to your local CCAdv member organization for ongoing support and services. And all of these services are confidential, safe, free, and voluntary. So again, you can reach Safe Connect via call, text, chat, or email. The URL is ctsafeconnect.org, or call or text 888-774-2900. This is just a quick snapshot of our 18 member organizations. Again, these are the organizations that would help you locally and continue to provide that support. And if you have any questions about today's conversation, please reach out to Kelly. Her email there, knelly@ctcadv.org. Please do follow us on Facebook, Twitter, and Instagram. And we hope to see you next week when we are going to be joined by the Connecticut Judicial Branch Office of Victim Services for a discussion about victim compensation. So again, thanks everyone for joining us today. We really appreciate your time. Bye.
Thank you, everyone.
Thank you. See you next week, everyone.